I'm Matt Willis, Public Health Officer for Marin County, with a COVID-19 update for April 9th. I'm going to offer an update on the vaccination plan, since this remains the most important strategy in our pandemic response. Next week, April 15th, all residents aged 16 and above will be eligible for vaccinations. We're well positioned to open it up completely. Currently, 65% of all Marin County residents above age 16 have been vaccinated with at least one dose, and 42% are fully vaccinated. We're on track to vaccinate all willing adults with at least one dose within the month, so your turn is soon if you don't find an appointment right away. While supply continues to be the limiting factor, our basic strategy is working well. We have two basic arms of our distribution plan. One is high-volume mass vaccination sites for the majority of the public, and the other is smaller, mobile, and pop-up operations to bring vaccine to harder-to-reach and more vulnerable communities. Our three mass vaccination locations, the Marin Center, Larkspur Ferry Terminal, and the Kerner campus in the Canal area, have a simple goal of vaccinating as many people as possible, moving every dose we receive from the state. Together, these sites have the capacity to vaccinate 6,000 people per day. Current supplies are only about half of that, but we maintain that capacity for the day when we have more supply to match that capacity. Unfortunately, yesterday we learned that next week, just as eligibility increases, we will be receiving fewer doses from the state. This is a temporary downstream effect of the loss of 15 million Johnson & Johnson doses in Maryland. No second dose appointments will be affected, but we won't have quite as many first dose appointments for next week as we'd expected. The mass vaccination sites are based on the "if you build it, they will come" idea, and it works for many residents, but not all. Some can't come or need more assistance, which leads to our second main strategic arm, mobile operations. For vaccine equity, we've prioritized vaccinating in those communities where the burden of COVID-19 and the ongoing vulnerability is highest. After our mobile teams completed rounds of all long-term care facilities in Marin County in February, we've had no cases, zero, of COVID-19 among facility residents in 2 months. And we are among a minority of counties where a higher proportion of residents in lower income zip codes have been vaccinated compared to those in higher income zip codes. At 2/3 of all adults vaccinated, Marin has among the highest vaccination rates in the state. Looking back, our most successful strategies have always been due to partnerships that we formed first around testing, then managing hospital surges, then contact tracing, and now vaccine distribution. A good example of how partnerships are critical to our success is the Marin Center vaccination site. We've done over 70,000 vaccinations in that site alone. And if you were jabbed there, you saw staff from Public Health, Marin Health Medical Center, our fire departments, parks, libraries, and schools, volunteers from the Marin Medical Reserve Corps, and from across Marin County government, coming together to protect our community. Now, as case counts drop, and as we reopen our economy, many of those workers will be returning to their regular duties to resume services that have been deferred through this pandemic. We're grateful for the state of California for offering us additional staffing resources to backfill those positions to maintain the quality we've offered thus far. Next week, Kaiser Permanente will be joining us at the Marin Center, which will further increase our capacity by bringing additional staff and vaccine doses to that operation. KP has been a critical partner, and having them under one roof will accelerate our progress even further. It's good news that every day hundreds more people are protected, but we're not out of the woods yet. We've seen we have what it takes to manage this crisis together. But remember, there's still plenty of time on the buzzer, and we need to maintain our focus. Limit indoor social gatherings, continue to cover your face, physically distance, and limit non-essential travel. You can do your part by getting vaccinated now that the time is here for almost all of us. Please visit getvaccinated.marin.org, getvaccinated.marin.org for information about how to make an appointment.